Today we're going to look at how to perform and troubleshoot an EKG. First, you'll want to make sure that there's an order placed in Epic prior to performing the EKG. Next, you'll want to scan your patient's wristband. Once you've scanned your patient's wristband, your order will appear on the screen. There are a couple of things that you'll need to fill out in the order. The patient's height and weight, your technician ID, which is your employee number plus your first and last initial, and your location. If you're unsure of what your location is, you can note the location codes that are on the side of all EKG machines. After reviewing your order, you'll press Enter to get to the main EKG screen. Next, you're ready to put on your leads. Be sure if you leave a partial package inside the EKG machine to label it with the date. You'll apply your lower limb stickers and next your upper limb stickers. Ideal placement for these is the forearm. However, if you have a patient who's in a great amount of distress or has a lot of movement, the upper arm might be a suitable option for you. You might get a better quality EKG depending on their movement. Next, you're going to do a second intercostal space on either side of the sternum. Then you're looking at your apical area. Axillary, and your in-betweeners. Then you're ready to secure your leads. And you'll attach each one to the tabs on the stickers. Make sure when applying your EKG leads that the appropriate EKG lead connector is attached to the appropriate sticker. Look for the label to confirm that V1 is in the V1 position and likewise. One prompt that you may receive on your EKG screen is limb lead reversal. This could be something as simple as your right leg limb being reversed with your left leg limb. So the machine will let you know that to increase the quality of your picture. There are some other prompts that you may see, or maybe you're just not getting a high quality EKG, so you'll want to do some troubleshooting. In each EKG card, we have some flip cards for you to review to help you troubleshoot. So one thing is you might see a lot of artifact on the screen. If that's the case, it could be that the patient is moving quite a bit. You could talk with them about maybe taking some deep breaths, relaxing, and try to get them to stabilize as much as possible before capturing the image. Another thing could be that maybe there's a flat line in one or two of the leads. You never want to capture an EKG with a flat line, so make sure that you check all of your connections and make sure that there's no tanglements in your cords. Another error that you might see is 60 cycling. What this is it's electronic interference. It could be from telemetry leads. So if your patient is on telemetry, that could be interfering with the EKG process. What you'll want to do is simply disconnect your telemetry leads from the monitor and try and capture the image then. It should clear up for you. If it doesn't, and you're on an inpatient bed, you might consider unplugging the bed from the wall. That could also be where your electronic interference is coming from. Once I've captured my EKG, I'm going to go to More and click the corresponding soft key. Next, I'm going to select Main Menu and then File Manager. File Manager is where I'm going to be able to view all of the active EKGs that are in the system. I have two here. Now this patient was tremoring quite a bit when I did his EKG. So I want to select the first one. That was my good one. So I'm going to go ahead and hit select. Select will bring it up as white. I'm going to highlight it by selecting enter. Then I want to edit it. I want to put in a comment. Since he did have tremors, the overall quality isn't ideal, but it's the best possible for this patient. So I'm going to hit edit and scroll down using my arrow keys to questions. In remarks, I'm going to type in best ECG and hit enter to save. I'm scrolling back down to return to the file manager screen. Next, it prompts us to select store. This will store the changes that I put. It can also print another copy so that if I'm giving my EKG directly to the physician, they can see the notes. Next, I'm ready to transmit that EKG now that I've added the comment. So again, I'm going to hit select and I want to transmit this first one here. And I'm going to hit enter to highlight. The final step is to hit the transmit key, which is F4. Remember, this will send it to Epic, so you only want to do this with EKGs that are ready. They have any comments you need in there and they're high quality. You're ready to send them to Epic. So you hit transmit. Now I want to clean up my other active EKGs. This EKG was not as high quality as the one that I transmitted. So I'm going to go ahead and select it, highlight it by pressing enter, and I'm going to delete it. So to delete, you'll hit the soft key corresponding with delete, and it requires a password. The password here at Lakeview is system, S-Y-S-T-E-M. It'll give you a warning just to make sure, are you really sure you want to delete these files? And we're going to hit enter to continue. Or excuse me, we're going to hit yes to continue.